Hey guys, it's Dr. Justin Southall and Dr. Toby Southall from Eastern Shore Chiropractic and Sports Clinic in Fairhope, Alabama. Today we're going to discuss how to ease your shoulder pain at home. These are some of the exercises and just mobility drills that you can do to ease that pain. And when we're talking about shoulder, we're actually going to be talking about the shoulder joint itself. Not going to be talking about any pain through here. This is actually your mid-back thoracic area. We're going to be talking about the shoulder. And today we're going to be using some very basic tools, but some of the best tools that you can get. And a shout out to Rogue Fitness for making such good products with the Supernova, and these resistance bands are fantastic. A lot of y'all have been loving some of the videos that we've been putting out, and most of the information we get is from Becoming a Supple Leopard by Kelly Starrett. So a huge shout out to him as well, because he does such a great job with mobility, and we give it to our patients, the drills to do, the mobility, and they get excellent results. So we're going to start out with, we're going to do a little demonstration of the little bit of fixation, because Dr. Toby has a little bit of issue with the shoulder issue from all the working out that she gets done. So she's going to take her thumbs and she's going to take them straight up overhead. Go ahead and take them straight up. And as you can see, she's got nice flexion here and just a lack of flexion in this right shoulder. So we're going to target this right shoulder. So first off, we're going to use that resistance band that you're going to get from Rogue, or we have them here as well at the clinic if you're a patient. So she's going to take this resistance band, she's going to place it right over the first rib in the trap right here. And I'm going to actually have her step out so we can see it a little bit better. And she's going to bend the knee and she's going to put the band right under the foot. And she's going to step straight down. So what she's going to do with that is she's going to take that shoulder up into flexion. So you take it all the way up into flexion, and she's going to externally rotate. So I'm kind of pushing that, but she's going to try to take it because she's got that restriction and that pain in there, and she's just going to turn that thumb back a little bit and get that external rotation. While she's holding that external rotation, lift the shoulder up, and she's going to drop it down. She's going to lift it up and drop it down, and she's going to do this about anywhere from 3 to 10 times. There should be no serious pain or anything like that. You should just feel a little pressure on this trap. You can go ahead and relax that. We're going to go ahead and have her take that off. So she's going to step out of it. Perfect. And she's going to pull it off. So if you don't have this band and you're sitting there right now and you're like, dang, my shoulder is hurting, I've got that lack of range of motion, we're going to show you how to use either a golf club, or everybody has a broom. So we're going to take you right over here, and she's going to take the butt end of a broom or golf club, and they're going to stick it up against the wall. And we already have a broom laid out because everybody has a broom. Go ahead and lay down for me. And she's going to apply that butt end right into that first rib and right in that trap. And she's able to keep her knees bent, and she's able to do that exact same motion. Get that in there. And come on all the way up, and she's going to be able to externally rotate that thumb. Take it back. If by doing this, she's able to control her pressure. If she needs to go a little deeper, a little bit more, it hurts so good, she can bend her knees up a little bit more and push herself into it. If it's too much or too much discomfort, she can simply just back off. So go ahead and do that as well. And she's going to just elevate the shoulder as well and drop it down. Elevate, and it's going to lengthen the fascia and the muscles all through this region through here. So go ahead and raise up for me, and just after doing that simple thing, go ahead and demonstrate the change in range of motion from that. Go ahead, all the way up. So with that, that's already changed flexion by a good 15 to 20 degrees, which is going to reduce her pain significantly. So we got two other things to show you. So again, the Supernova from Rogue Fitness, which is awesome. You're going to take it and come on over here, and what we're going to do is we're going to apply it to the posterior capsule of the shoulder, and she's going to lean up against the wall and just allow that to dig in. She's also going to take it and get right under the back side of the posterior shoulder through here and work the serratus anterior and all through this muscle of the lats, the teres major minor, all that muscle group, and try to get it to release. So she's going to do it on the wall right here so you can actually see it. So she's going to take it, she's going to place it right there, and she's going to lean. Again, her shoulder is going to go up into flexion, and she's going to take that thumb into external rotation, so taking the thumb back. And she's leaning in there for anywhere from 15 seconds up to a minute, and it should never be seriously painful. You should just feel like it hurts so good. Good job. If you don't have the Supernova, which I highly recommend you get, you can use a tennis ball, you can use a lacrosse ball, you can get them at Dick's Academy, any place like that, they have them. And the final thing that we're going to do with the shoulder, once we do that mobility, is we're going to activate the posterior chain. And what she's going to do is she's going to take this simple resistance band, again, something you can get at Rogue Fitness, and she's going to put it straight out in front of her. Her elbows are going to be locked, and she's going to pull it apart so that it actually hits her sternum here, and she's going to hold it at the very end. Very good. Hold that. Keep your head neutral. So she has contracted all these muscles in the posterior chain, which is a nice isometric hold for anywhere from a 1 to a 3 count, and relax it. And she can do that a series of anywhere from 1, just holding that, up to 10 nice steady contractions, just holding that all the way through. Nice, good contraction. So again, if you're having shoulder pain, check this video out, share it with friends, like us, comment on us. If you have any questions, send us a message. We'd love to help you out. Again, Dr. Toby, Dr. Justin Southall, Eastern Shore Chiropractic. We are your Fairhope chiropractor, and it's your life. Live it in health.